The signs and symptoms of OSFED can be widely variable. OSFED can present like any type of eating disorder, but in particular we'll find people with orthorexia, so people who have developed strong beliefs about good foods and bad foods, and they start to develop ideas about ultra healthy food practices. So it starts off as something to be healthy, and it ends up with being exactly the opposite, being really quite unhealthy choices. Sometimes people with OSFED will engage in obligatory and compulsive exercise. They were pursuing exercise in order to feel stronger, more powerful, more fit, but once the eating disorder kicks in, they're actually engaged in the exercise patterns in order to get away from an uncomfortable feeling. It's not about pursuing health anymore. Now it's about avoiding the discomfort of not engaging in the behavior. The symptoms of night eating syndromes are you wake up in the middle of the night often, or you're eating most of your calories after your evening meals. So it affects every part of your life. You're not sleeping well, your mood is often affected, your relationships are very affected. Purging disorder is one of the things we see in OSFED. Often eating normally, sometimes even restricting, but not binging, but they're engaging in purging behaviors. The most dangerous example of purging disorder is diabulimia. These are patients with usually type 1 diabetes who are skipping insulin or underdosing their insulin so that they will be able to purge the calories. And so they're losing weight because they're underdosing their insulin. This is a very dangerous problem. The long-term consequences of diabetes are enormous. People become blind, they develop kidney problems. So they're thinking about, if I give myself the insulin, I'll gain weight. Or if I skip the insulin, I will lose weight. And it can get really very, very dangerous.